So today we're going to be going through some basic gyri and sulci of the brain on a non-contrasted head CT. As we scroll through the packs, I'll be pointing out some of the major anatomic landmarks, and we're going to start right here at the top. The first structure I sort of want you to appreciate at the top is this sulcus right here, and this is going to be an important landmark for a number of reasons. This is on the left side of the patient, and this is on the right side of the patient. This is the central sulcus, and the way you can appreciate the central sulcus is by the fact that it has an inverse omega sign that you sort of see right here on this side and sort of a little bit more gradual on this side. But this is the central sulcus, and anterior to the central sulcus is the frontal lobe. Posterior to the central sulcus is the parietal lobe. Now, with this, you're going to be able to identify several other structures even on this image alone. So, again, this being the central sulcus here, you're going to start seeing the post-central sulcus, which is the first major sulcus behind the central sulcus. And on the right side, you get a better depiction of the pre-central sulcus here on the right. So again, this is the central sulcus on the right. This is the pre-central sulcus, central sulcus on the left, post-central sulcus. Now, even on this image, you can appreciate a couple other sulci that are going to make a T-like configuration with the pre-central. So the T-like configuration here that this is making, this is the superior frontal sulcus, which makes a T with the pre-central sulcus here. Now, the superior frontal sulcus is going to differentiate your superior frontal gyrus from your middle frontal gyrus. On the left side here, the post-central sulcus that we see here makes this T-like intersection with this sulcus. And this is the intraparietal sulcus here on the left that you're seeing. So the intraparietal sulcus is going to differentiate your superior parietal lobe from your inferior parietal lobe. So again, find that inverse omega. That'll be your central sulcus. And then you can see a lot more sulci from there. Your superior frontal sulcus, your pre-central sulcus, your post-central sulcus, and your intraparietal sulcus. The other sulcus you're able to appreciate on this image is this sulcus right here, and they call this the mustache. This is the sulcus that's just posterior to the central sulcus, and this is going to be called the marginal ramus, or the marginal extension of the cingulate sulcus. Now, to explain that a little bit further, I'm going to have you look over here to the sagittal imaging. I'm going to point out a couple structures to you on the sagittal imaging. So first of all, we're all pretty familiar with this large white matter structure sitting right here, and that's the corpus callosum. Now, sitting on the corpus callosum is what we're going to call the cingulate gyrus, and that cingulate gyrus along its superior margin has what we call the cingulate sulcus, and you can sort of make it out here. Now, this cingulate sulcus goes right out like that. This is the marginal ramus, or marginal extension of the cingulate sulcus. This is the same structure that you're seeing as a superficial landmark right here. The significance of that, again, is just to get your bearings in that the sulcus just anterior to that is the central sulcus. The point I'm going to make here about the central sulcus, you guys know the importance of this. Anterior to this is the precentral gyrus. Posterior to this is the postcentral gyrus. The precentral gyrus is your motor strip. The postcentral gyrus is your sensory strip. If you go back to the sagittal imaging here, you get a better idea. If I follow that structure, remember that being the marginal ramus, and I just scroll a little bit back and forth, this again is going to be the marginal ramus. So a better view here is probably a little bit oblique, so you're not seeing it as you would imagine along its sort of anticipated course, which would be right there. The point of this is the sulcus just anterior to the marginal ramus is your central sulcus, making this your motor strip and this your sensory strip there. Okay, so that's the importance of seeing that on the sagittal imaging, especially a decent midline sagittal image. That's helpful for that. While we're here, I do want to point out a couple other features. This is the parieto-occipital sulcus here. And remember, if this is the marginal extension of your cingulate sulcus, and this is your central sulcus here, anterior to that is going to be your frontal lobe. Posterior to that is going to be your parietal lobe. The parieto-occipital sulcus is going to separate your parietal lobe anteriorly from your occipital lobe posteriorly. So you get a pretty good depiction of that on the sagittal imaging. You can probably vaguely make out a sulcus probably sitting right here. That's going to be the calcarine sulcus. Remember, this is the parieto-occipital sulcus, the marginal extension of the cingulate sulcus here, and then the central sulcus here. They have a term for this. This is called the precuneus here, the parieto-occipital sulcus here, and the cuneus here. So again, cuneus, this is the occipital cortex, precuneus in your parietal cortex. Calcarine sulcus here, this is sort of the lingual gyrus of the occipital cortex, sitting underneath the calcarine sulcus. This being your tentorium here, just to give you some bearings there. So let's get back to the axial imaging here. We got a good idea of identifying that inverse omega to get your central sulcus, the post-central sulcus with the intraparietal sulcus here, the precentral sulcus making a T-like configuration with the superior frontal sulcus there. As we scroll up and down a little bit further, going a little bit more inferiorly now, once we get to the area of the cingulate gyrus, remember that sits right on top of the corpus callosum. So if you want to sort of get your bearings on where the cingulate gyrus may be, this is probably the body of the corpus callosum here. And the reason I say that is because we know it's a white matter tract, and you see how it's a little bit lower density than the overlying gray matter cortex. You see have some white matter tracts here. You have the genu of the corpus callosum here. So it's probably the body of the corpus callosum here. Now if I go just a little bit more superiorly, we're probably in the region of the cingulate gyrus. The only point I really want to make here is that at the level of the cingulate gyrus, you may be able to appreciate the difference between the superior frontal gyrus and probably this structure being the middle frontal gyrus there. Again, that's going to be at the level of the cingulate gyrus, which is probably just above the body of the corpus callosum. From here, we're going to scroll down just a little bit further and get to that level of the corpus callosum. Not only are we at the level of the corpus callosum, which you can appreciate here is the genu of the corpus callosum, but you can start to appreciate the sylvian fissure here as well. At this level, it's pretty safe to say that we are going to appreciate the inferior frontal gyrus here. And there's a couple important points I want to make about the inferior frontal gyrus. We know, at least for the majority of the people on the left side, this is going to correspond to Broca's area. And we know that lesions or infarcts or anything like that in Broca's area will lead to a non-fluent aphasia, sort of language issues in that case. So this is an important area to keep note of. Remember, it's at the level of the corpus callosum. Here's the genu here. You can see the internal capsule here. This is going to be the inferior frontal gyrus, especially on the left where Broca's area may be. We get a little bit of an idea. This connection here would be the insular cortex, and ultimately we're getting into the temporal lobe here, which I'm going to make a few comments on as well. But important to recognize that as the inferior frontal gyrus. Now, while we're here, we'll continue to scroll, and we made the point of saying this is more than likely we're starting to get into the superior temporal gyrus here. Oftentimes people will say at the level of the thalamus. I know we have the cut of the corpus callosum here, but we're also at the level of the thalamus. And the thalamus is this deep gray nucleus right here. We'll go over deep gray nuclei in another module, but it's this paired gray matter structure here that marginates the third ventricle, which you see there. At the level of the thalamus now, we're really starting to get into the superior temporal gyrus, which we're going to see right here. It's sort of bordered a little bit more obliquely, anteriorly. We get an idea of that here. A clinical correlation here is that a lesion in the left posterior superior temporal gyrus. This is Wernicke's area, and that will produce unintelligible content, though you will have normal syntax and normal rhythm of language. So you want to be cognizant of the posterior portion of the superior temporal gyrus on the left is generally considered Wernicke's area. That is going to be probably better depicted on the sagittal imaging as we get here into the temporal lobe and the superior temporal gyrus. And once we get into this area here, we're really considered to be Wernicke's area. As we mentioned before, this area here is the inferior frontal gyrus, and these little lobulations, all which have little names, that's going to be considered Broca's area here. So consider that Broca's area, and consider the posterior portion of the superior temporal gyrus, Wernicke's area. Another point I'd like to make about the superior temporal gyrus, and again we can sort of better appreciate this on the sagittal imaging. The superior temporal gyrus, really the upper border of this, has what we call the transverse gyrus of Heschel, which constitutes the primary auditory cortex. So keeping that in mind is the superior aspect, the superior border of the superior temporal gyrus is where the transverse gyrus of Heschel lives. We want to keep that in mind. We talked about being at the level of the thalamus to appreciate the superior temporal gyrus. As we go a little bit more inferiorly, we're going to get to the level of the midbrain here, and I'm going to just draw out the midbrain for you there. There's that left cerebral peduncle, the right cerebral peduncle. We come around in the colliculi there, and that'll be another session that we get into. But when we're at the level of the midbrain, we want to understand that we're probably at the middle temporal gyrus level here. Certainly we're well into the inferior frontal lobe here anteriorly. A couple other structures you can appreciate was the tentorium opening up for you there. Again, if I scroll back and forth, we see that tentorium opening up into the cerebellar vermis, ultimately into the cerebellar hemispheres. But again, at the level of the midbrain, you're sort of at the middle temporal gyrus. Other anatomic structures that you can appreciate at this level, the temporal horns of the lateral ventricles. Again, as I scroll up, once you start seeing the tentorium, you know the cortex adjacent to that tentorium is going to be the inferior occipital lobes, because we're actually just opening up into the infratentorial compartment at that point. So, pretty good idea of what we have there. One important point to make here, again at the level of the midbrain and the middle temporal gyrus, is the most medial aspects of the middle temporal gyrus contain the hippocampus, the amygdala, structures like that. These are going to be really involved in the consolidation of memory and learning. So pathologies like hippocampal sclerosis and Alzheimer's dementia, those types of things are going to take their toll on the hippocampal structures, which are the most medial portions of the middle temporal gyri. Much better depicted on MRI imaging. So let's scroll a little bit more inferiorly. We have the pons coming into play now. And once we're at the level of the pons, we can certainly be comfortable in saying that we're at the level of the inferior temporal gyrus at this point. Definitely subfrontal lobes over here. You can again appreciate the temporal horns of the lateral ventricles there, the pons there, the big arms connecting the pons to the cerebellum, which will be the middle cerebellar peduncles. Let's turn our attention a little bit to the sagittal imaging once again. I want you to appreciate that lateral or sylvian fissure there. A couple points I want to make about some of the cortex that's marginating things on the sagittal imaging. The cortex that's marginating the sylvian fissure here is going to be called the supramarginal gyrus. And that sort of sits right there. Now, if I scroll a little bit back and forth, you don't get a great appreciation for it, but this being the temporal lobe here, you can maybe vaguely delineate the superior temporal sulcus, which may be going here. And then again, this is probably pieces of the sylvian sulcus. Once again, this is the supramarginal gyrus that borders that or hugs that. And the one that hugs the superior temporal sulcus is going to be the angular gyrus. So again, supramarginal gyrus there, angular gyrus there. You just need to know that both of these sort of hug the posterior border of the central sulcus and superior temporal sulcus, respectively. As far as the clinical correlate there is concerned, the supramarginal gyrus functions in word recognition, both the meaning and the phonology of words. The angular gyrus is more involved in giving words meaning. So you're going to see that again, the angular gyrus a little bit more inferiorly. As far as the frontal lobe, the inferior frontal gyrus is concerned, once again, we're probably seeing portions of that operculum sitting here, sort of three pieces to that. The pars orbitalis, which would sit here, the pars triangularis, which would sit here, and the pars opercularis, which probably sits right about there. But those are pieces of the inferior frontal gyrus that are going to overlie the insular cortex along the anterior margin of that. So that's going to wrap it up for the basic sulci and some of the few basic gyri of the brain. Again, great if you can get your first landmark here with that inverse omega sign marking the central sulcus. Once you have that, scrolling back and forth a little bit really helps you out and identifying some of the more the more prominent structures that may come out. Again, on the right, the precentral sulcus here, superior frontal sulcus forming that T shape. Here's that post-central sulcus forming that T shape with the intraparietal sulcus. Don't forget that mustache sulcus there, which is the marginal ramus or marginal extension of the cingulate sulcus, and so on. So once you get your bearings there, we can go on and get some of the normal anatomy. We'll continue with subsequent modules.